Let's discuss hand Yang large intestine meridian, shoulder joint. Here is the illustration of hand Yang large intestine meridian, LI 15, on the anterior depression of the shoulder between the anterior end of the lateral border of the acromion and the greater tubercle of the humerus at the corner of the shoulder. LI 15, shoulder joint, shoulder bone, shoulder transporting point, shoulder tip, and bone. Point of the Yang Qiao. The large intestine divergent channel separates at LI 15, enters the spine at the nape of the neck, do 14, and passes down to join with the large intestine and lung. Second branch ascends from the shoulder along the throat, emerging at the supraclavicular fossa, stomach 12, to rejoin the primary meridian. The energetic geography here can be tricky to negotiate. It is a place of transition as the meridian ascends towards the head, and the head being the heavenly aspect of the body. The connections that LI 15 makes here, the crossing with the Yang Qiao with all its influence in the head and lateral aspect of the body, and branching from here to meet with Du 14 and stomach 12, gives Jianyu wide influence in this area of the body. The Yang Qiao with its partner, Yin Qiao plays a part in regulating and balancing yin and yang and the rhythms of the body, which here reinforces the influence of the Pu with its regulation of the patterns and processes of the body. This may be why this point is beneficial for shock. Shock interrupts our inner processes and timing, and this point can help reestablish regularity. As a place of transition, this point remains one of the tension metal exercises in maintaining the connection with the heavens and inspiration, the present moment, and justice even while in free fall. This point, with all its clear yang confluence, helps maintain the connection for the large intestine with Qi of the heavens. LI 15 brings refreshment, invigoration, and a sense of spaciousness to the brain through its position and connection with the Yang Qiao. This can bring relief with the tendency of the large intestine to overprocess information and emotions, as well as headaches that can result from such overprocessing. The connection with Yang Qiao helps enliven the controller of drainage of the dregs when it has become dull or contaminated through overwork or deficiency, manifesting as a cynical, poisoned, and suspicious spirit, or a mental level with no longer distinguish the gems from dross in the material it processes or life. Good for mental and general exhaustion. Probably the most frequently used and most important local point for the problems of the upper arm and shoulder. It is also often used as one of the chain or group of points to free the shoulder. LI 15 benefits sinews, the yang min being rich in blooded qi, and so bringing warmth, nourishment, and strength. Moxa can be helpful here if appropriate. Promotes circulation of qi in the channels, connection with Yang Qiao. Expels wind through its connection with Yang Qiao and thus can also be useful secondary point for skin rashes along with LI4 and LI11. LI15 can help to control excessive sweating with LI4 and kidney 7, or with SI9 for excessive underarm sweating, stops pain, soften hard masses. Given as a first aid point for apoplexy, concussion, electric shock, exhaustion, hemorrhage, head injury, shock. Indication: mental dullness and headaches, paralysis of the arm, shoulder or hand, atrophy of the arm and upper body, arthritis, bursitis, trauma through shoulder, frozen shoulder, excessive sweating, thyroid, goiter. This point connects to the head, neck, brain, and spine along with 214 and stomach 12, and as such is effective for mental clarity and for invigorating the system. Often used for problems of the upper arm and shoulders. Consider moxa here for a frozen shoulder. For excessive sweating, particularly under the arm, beneficial when the system has been shocked or concussed. Thank you for your attention.